Hello, everyone. My name is Sarah Taser Ben-Sharif. You can call me ST, and I'll be your I'm a health reporter at POLITICO, and I'll be your moderator for this next session. I'd like to welcome you all, both in person and online, for what promises to be an enriching conversation with our esteemed guest, Dr. Andrea Ammon, the director of the European Center for Disease Prevention and Control. I've got my questions, but this is also an opportunity for each of you present in person and online to send in your questions through the Swap Card platform. The instructions on how to do so are on our event website. If you're using a computer, you'll find the questions box at the top right of the screen, and if you're following along in your phone, it'll be just below the live over here. And for those of you in person, POLITICO Live has provided some flyers and leaflets on how to use the Swap Card platform and ask us your questions. With all that said, I'd love to dive into our conversation. I'd like our conversation to be as forward-thinking as possible, but I really can't pass up the opportunity to glean some lessons from you about the last couple of years. Dr. Ammon, you've been at the helm of the ECDC since 2017, and over the last few years, you've kind of seen it all. You've seen times of relative calm, a pandemic, a monkeypox public health emergency of international concern, and a new war in Europe. What's that been like for you as director of the ECDC, and how have you managed to pivot from crisis to crisis to crisis?
Yeah, that was very interesting experience, I have to say. For me, it was most reassuring through all this, turmoil. That I have a very experienced, motivated, and dedicated workforce, the staff of ECDC, and a good relationship to our partners that need to help us, that actually allowed us to get the work done, because that was the major concern. How on earth do we get all this work done that we have to do?
Yeah, please go ahead.
And the other area where we really worked hard was to make sure that the systems that we have been operating, our European surveillance system, is really up for the challenge, because it has some years on the machine, and it's had to receive weekly data amounts that we have received in previous times in a few months, if not in a year. So it was really here also the challenge for some time, and some of our staff to work overnight to make sure that all the data that our stakeholders in the member states gathered with a lot of effort to make it available to us timely, that they really can also be presented then. And that is not our part that makes the thing fail.
Fair. It sounds like the experiences you've had in these turbulent times are particularly unique, and it's more than likely that nobody is going to experience what you've experienced at the helm for a few decades or so, we hope. If you were to write a letter to whoever will be the director of the ECDC in a few decades' time, through when the next pandemic hits, and inevitably it will, what would you write in that letter? What would you tell them, and what wisdom would you impart on them?
I think the most important part was to stick to the evidence and the science whenever it was possible. And on the other hand, be also prepared to deal with uncertainty, and be prepared to give advice when there is no evidence, which actually was the case for many periods in the past years. The second important element is to preserve the scientific independence of the institute or the center, because there were many requests at times to tweak the guidance, to put out a certain specific guidance, and it's very important, of course, to listen to stakeholders. I mean, they came from all sides, right, these requests. To listen to stakeholders, take their situation into account, but be ready to draw a line where the science ends and where you cannot support it anymore. And then that feeds into the third advice: don't be afraid of losing your job. Because that is something that makes you maybe distort decisions that you regret at one point.
Were you afraid of losing your job?
No, that is actually what I decided very early on when I saw that this thing will become big. That whatever I have to do, I want to make decisions that at the end of the day I can look in my face in the mirror, and I said, and if they fire me, they fire me. And that gave me a certain quiet and peace throughout the time.
How long is this letter going to be? It's a lot of advice. It's going to be quite
That's the major part.
It's great. Thank you. My next question might not be the easiest one, but obviously we've had some highs and lows in the last couple of years, and I'm just wondering, do you have any regrets on how some of the things unfolded, or, when you look back, what are some of the things that kept you up at night?
I mean, it's easily, of course, in hindsight to say, well, we should have done this differently. But you have to act, forward. You have to act with the knowledge that you have in a situation and with the people that you have, with the information that you have. And you have to be ready to correct it when new information arrives. So this flexibility was very important throughout the pandemic years. Now, of course, now when we're trying to prepare for the future, it is important to review and say, well, what worked and what didn't work. Because we shouldn't reinvent the wheel in the future, but we should fill the gaps that we noticed. So that, for me, is very, very important.
Okay, thank you. Obviously, the pandemic has spurred some pretty big changes at the ECDC, the main one being the extended mandate. The aim is to help the ECDC better support countries when it comes to prevention and control of infectious disease threats, and to improve European preparedness and response before the next crisis hits. It includes things like the creation of an EU health task force, and the goal of that task force, as I understand it, is to help local responses to outbreaks. It also includes developing digital platforms for epidemiological surveillance. There's a number of things that are part of this expanded mandate, but I'm wondering, what's the single most important one for you and why?
I think, for me, the most important part is that in order to implement this, first of all, I mean, I'm very happy that we got this mandate, this amendment in the mandate, because it helps us to do changes that probably would have been difficult to do otherwise. But it's also clear it's the ECDC mandate, and we have obviously a very strong role in implementing this. But we cannot do this alone. So it is very important that there are other actors, and one is the member states, and the other is the Commission, because there are a lot of implementing acts that have to be put in place so that we actually can act on the mandate. And for the member state, it is very important that we can support them to a certain degree, but there needs to be a will, a political will to invest in public health and in health systems in the wider sense, despite all the pressures on the budget that we're seeing right now. And without that, we alone cannot do it.
Do you feel that political will is there now after what we've gone through?
It's still, the memory is still there, so we have to hammer the iron while it's still hot. But we hear already from some colleagues in member states that the extra resources that they got, they are taken away. So I think we are, I won't say running out of time, but I think we have to do really a frequent reminder what will happen if these investments don't come.
Yeah, thank you. Knowing what you know now, do you feel that the expanded mandate of the ECDC goes far enough? And if not, what else would you like to see fall under your remit?
I mean, when you look at the original proposal, it was really set to tackle some of the lessons that we all have seen in the area of surveillance, in the area of preparedness, and well, a few other areas. they're taken up. So the the purpose was not to fix all the woes of the ECDC situation, but to tackle the lessons learned. Now, of course, I had wishes for more. We have made also the proposal that it would be an opportunity to extend the monitoring of just infectious diseases to health monitoring, monitoring all health parameters. But it was very clear that that was not favorable at this point in time. So I said, okay, we stick to the infectious diseases. The other part is, of course, that the competence division between the EU and the member state in health didn't change. So although the mandate says now that we can give non-binding recommendations, whether this changes something will depend on the willingness of member states to take up our recommendations. And that is the same as it has been so far. So we will have to work more closely with the member states to make sure that these recommendations are in a fashion that challenge them, but they are still realistic for them. And that will require a change of working from our side with the member state, a different interaction.
It's interesting that you said that, if I understood correctly, that you were wishing for an extension of monitoring to beyond infectious diseases to include all health parameters. My question is, if a pandemic is not the time to really see the connection between infectious diseases and all parameters of health, when will be the right time to implement such a thing?
Well, the next point in time that is already penned down is in 5 years from the start of the coming into force of the mandate, there will be an evaluation where this question will be taken up again. And so we have these 5 years where we can work on our arguments and the convincing of the stakeholders.
Are you optimistic about this?
I think eventually it will go this way. Whether it's in 5 years already or whether it's another, I don't know. I would have hoped that it would happen under my watch. It didn't, but a lot of other things happened. So I'm not too sad about it.
Fair enough. Thank you. We're talking about health monitoring, and one of the things that really struck me over the pandemic is the importance of data. As soon as we could, we started counting cases, we started counting hospitalizations, deaths, vaccinations, and inevitably people wanted to draw comparisons to see how one region or country was faring compared to another, but it became pretty clear that the type of data and the quality of the data available varied substantially. Concretely, how can the ECDC's extended mandate help when it comes to data collection to allow a deeper analysis in a time of normalcy and in a time of crisis?
I mean, one thing is that we will work with colleagues in member states on standards. On standards of collecting data and standards also of testing. Because I think that was one of the main influencing factors that the testing policies in countries were quite divergent. And then, of course, the result that you get gives a different picture. So that is something that we will be working on. The other thing is, of course, that you have some other data sources. We are working now on several pilot projects, seeing whether we can use the data from electronic health records for the surveillance and see whether this is possible or what kind of obstacles there are that need to be tackled in order to do this in a broader sense. But in essence, since the national health systems will be always different, there will be, of course, always differences. But I think our aim is to smoothen it at least more than it is now.
Yeah. All of these lessons that you've learned, I'm sure that you'll be carrying them into this third pandemic winter. And we're hearing growing concerns about what's been dubbed the twindemic. No, it's not the epidemic of twins. It is the rise of both COVID cases and influenza cases. And we're hearing urgent calls for people to get vaccinated, but I had a look at the figures and they're a little bit discouraging as they stand. I mean, according to the ECDC's vaccine tracker, 54% of the total population in the EU EEA got their first booster, but that figure plummets down to 7.7% when we look at the second booster. At the same time, overlapping all of this, we're seeing healthcare systems across the board struggling with healthcare staffing shortages, and so there are understandably concerns about, are we going to be able to handle a surge in both COVID and influenza cases? What needs to be happening for the urgency to be really impregnated and conveyed, and what needs to happen for the warnings to be heeded?
Well, I think we have started already in summer to work with the countries on what kind of surveillance we need to have in place, because I think the basis for all actions is a good monitoring. And the monitoring needs to be done both for the cases in the community, but also for the severe cases in hospitals. So we have made proposals. Many member states have already changed the systems so that they have integrated the COVID surveillance into the surveillance of other respiratory diseases, in particular influenza, but other member states said they cannot do it now, they have to do it in the next summer. So we will have a bit of a patchwork still, but in terms of the surveillance. But we said also it is not necessary to test the whole population anymore. You know, this wide population testing that was so popular at one point, it's not necessary anymore. It's rather to have a representative sample tested and sequenced, and of course tested and sequenced for all that are ending up in the hospital. And then we have a good basis for when new variants start, when a wave starts, when certain age groups are affected. So then you can place decision. In parallel, of course, the vaccinations have to go on, and in particular for those groups in the population that are at higher risk for severe disease. And the figures that you mentioned in the whole population, they look a bit more encouraging when you look at the 60-plus age groups. But also here, the fourth dose is at 20-something%. So it's still to be further improved. And what we say is, when you get these people for the vaccination, for the COVID vaccination, give them the flu vaccine at the same time, because they're already there. Yeah,
2 for 1.
I mean, it's an optimization of opportunities that you have to use.
Yeah, absolutely. It's a 2 for 1 at the doctor's office, so
yeah,
not a bad deal. I'm glad you mentioned variants, and I'll get back to the new variants rather, and I'll get to those in a moment. But you mentioned surveillance and how there's a new way to tackle surveillance, but we also heard concerns over the course of the pandemic about laboratory capacity as a limiting factor to surveillance. And you know, now that we're looking ahead and seeing a projected increase in both influenza and COVID cases, does Europe have sufficient laboratory capacity to deal with such a surge? And I know that with COVID, we have access to rapid tests, and that might, you know, decrease the number of PCRs that have to go to a lab. But still, do we have enough capacity in 2022?
I mean, we are in contact with the microbiologists in the countries very, very regularly, and are monitoring this. We have last year, with a massive financial support from the Commission, rolled out sequencing infrastructure grants to 24 countries. In order to make them capable of doing the sequencing themselves. But in parallel, we are also offering for those countries that don't have the capacity that they can send samples to a contractor from us, and we pay for it. And that is currently used by about 10-ish countries. And so there is, at least for every country, the possibility that they can have a sequence monitoring in place to detect to detect the variants on time.
Okay. I just want to remind the audience in person and online that you're welcome to throw in your questions over the swap card platform. I also just want to flag that I'm unable to see the questions right now on my iPad, but I will get that sorted out in a moment because I do want to get to your questions. But back to you, Dr. Ammon. So you mentioned new variants, and it's kind of a really telling moment that we have new vaccines that target the latest variants, the BA4, BA5, as well as the BA1 vaccines, just at the same time as we're having the emergence of yet another new subvariant, the BQ1. I'm wondering, what do you make of this rapid evolution of the virus and our challenges in keeping up with it when, pretty well the same month that we started rolling out these adapted vaccines, we have yet another new variant?
I mean, we knew that this was a possibility that such a situation happens, that although these adapted vaccines were quite quickly put in place, but I mean, the virus is quite fast. And we knew that that might happen. So we also have to look at that the vaccines were designed to reduce the risk for severe disease and death. And that they do still. Okay. Now, of course, with every new dominant variant that is coming up, we have to check whether this is still the case. So for the BA4-5, this was still the case, that because when you looked at the summer wave of BA4-5, I think the case numbers, although the testing was nowhere what it was before, were comparable to previous waves, but the hospitalization and deaths were not at all. They were at a much lower level. So a good signal that the vaccines still protect for severe disease and death. So we have to, and that is what we have to monitor for every upcoming variant. And for the BQ1, it's currently, we have it as a variant of interest, closely monitored because we see some increases, but right now they're still not at a proportion that really shapes the epidemic curve. The projections say that it might happen, and then we have to see whether the estimation that their growth rate is due to immune evasion will really holds true, and to what degree they will evade the immunity.
On the topic of this new variant, I'm going to ask perhaps a very basic question, but what do we know about how well rapid tests that are currently sold, how well they perform in detecting these new variants, and how do we make sure that the diagnostics we have, like the point of care ones that maybe don't get updated as frequently as in a fancy lab, how well are they going to help us stay safe from these new variants?
I mean, of course, with each variant, it has to be checked whether the current diagnostic tools are still capable of detecting them. I haven't heard anything that the current tests do not detect the BQ1. And we also have to see, although we say it's a new variant, it's still an Omicron. It's a variation of Omicron.
Right. We do have a couple questions from the audience. The first is a bit of a pivot in the questions, but we have Martin van Balen asking, given the recently extended ECDC mandate and expanded role of ECDC as an expert body setting standards for the prevention of disease transmission for substances of human origins, how does ECDC plan to ensure that all stakeholders, including industry experts, are involved and consulted?
I think the legislation is still under discussion as far as I'm aware, and we are preparing as much as we can, but I think the final setup has to be determined when the legislation is in place. So what we are already doing, first of all, we have now assembled a small team which we had before. We had just one person. Now we have a small team, and they are already preparing to set up a network with the authorities in the countries to prepare all these questions, a mapping of, for instance, how donors are tested for infectious diseases in the countries, and how this list of guidances that we are supposed to produce, how authorities need to deal with different infectious diseases in the donations of blood and tissues and cells, how this plan should be set up, because of course you can't do this all at once.
Thank you for that answer. We have another question from Salomea Romanescu, who I think this is in relation to the twindemic. They're asking, what measure could the EU take in terms of prevention? Are telework, telemedicine, and teleduties one of the measures that should be implemented?
I think there are some, for me, there are some standard hygiene measures that we should take from the last two years. And one of them is, of course, staying home when you're have respiratory symptoms, which is both for when you work, but also when you see the doctor. And I think there a lot of progress has actually been made in the past 2.5 years, which I also think the pandemic helped to accelerate.
Absolutely.
And the others, just to come back to my standard hygienic measures, is that you cover your nose and mouth when you sneeze and cough, and you wash your hand regularly. And that is something that shouldn't depend on any pandemic situation. You should do this in any case, because it helps not only for respiratory infections, it helps for foodborne infections, and it helps for reducing the risk of nosocomial infections.
Thank you. I'm going to try to wrap things up shortly. I have a couple more questions for you. So if I were to look at your agenda or with your to-do list, what's on your to-do list before the end of your mandate as director of the ECDC? What are the big things you really want to push through and get done before that chapter?
I would like to get the implementation of our mandate as far as possible, in particular regarding the preparedness, the EU Health Task Force, and the surveillance. There will be, of course, a plan to implement the European reference laboratories that we are already working out with DG Santé. But that is, I think, something that is a more, I wouldn't say autopilot, but that's very clear. Whereas for surveillance, how to set this up and how to really set up the strengthening of the preparedness, that is not something that is autopilot. So there I really will invest until the end of my mandate to have a dialogue with the countries to really have an optimal way to reach that.
Thank you. I just got one last question for you. To me, this seems like a very appropriate thing to ask someone who's been dedicating so much of their life to the surveillance and management of germs and parasites like bacteria, fungi, viruses. So I wonder if you might indulge my curiosity. What is your least favorite infectious agent and why? And you know, it's like the one that really makes your skin crawl and you just like would love to get rid of forever.
The more you learn,
and it has to be one. It can't be like all of them.
Let me start. The more you learn about infectious diseases, the less you like any of them. Honestly, because all of them have something you really do not want. So if I could, I would eradicate them all. But that's not possible. So this is why, well, we have the situation that we have. But if I really look into, I would not want, and that's not only one, any of the multi-drug resistant kinds. Germs.
Okay.
And it's not just because the previous discussion. I was yesterday at a session on AMR. We have the Antibiotic Awareness Day coming up, and AMR was one of the only topics that we continued to work during the past 2.5 years because it's so important.
Absolutely. Thank you so much, Dr. Ammon, for sharing your expertise and your time with us. And that brings us to the end of our session. Thank you again. So just to summarize the last couple of days, we've covered a ton of ground. We started off with a geopolitical analysis of healthcare systems in Ukraine, in the EU, and across the world, before we dove into Europe's regulatory framework post-COVID. We finished off yesterday with a deep dive into the various aspects of the pharma strategy and of the European health data space, before ending on non-communicable diseases and our 2 roundtables on the substances of human origin and telehealth. Today, we took a look at how the EU and the world can better prepare for the next crisis, and we considered whether Europe could get ahead when it comes to antimicrobial resistance. In a perfect world, those bugs would be gone, but we don't live in that world just yet. Lastly, we capped off our summit with an interview with my esteemed guest, Dr. Andrea Ammon. We'd like to thank each of you, both in present and online, for taking the time to join us at this year's summit, and we really hope to see you at next year's edition. This summit wouldn't be possible without our partners. The leading partners are Janssen, FPA, and Pfizer. The presenting partners are Bayer and Teva, and our networking partner, the Plasma Protein Therapeutics Association. I'd like you all to mark your calendars, please, with POLITICO Europe's upcoming Sustainable Future Week, which runs from November 29 to December 1st in Brussels, and the Finance Summit on March 23rd, 2023, which will be in Paris. And with that, thank you all, and a big thanks to our guest, Dr. Ammon, and we'll see you all next year.
This is an age of disruption, of profound revolutionary change.
What we're really asking ministers is to empower the ambassadors.
The only thing that you really push forth is the truth.
You don't see many women represented when it comes to the decisions as to how to handle the pandemic.